Just affected by all of this poor girl. Well, there's been a lot of news about new variants, the rising number of new COVID-19 cases. More and more university campuses now saying they'll make it mandatory to be vaccinated, to go on their campuses. Already the University of Cape Town, University of the Western Cape, University of the Free State say they'll follow a policy of mandatory vaccinations. Professor Ahluwalia is the CEO of Higher Health. Professor, good afternoon to you. First, let's just explain what we mean. When we talk about a policy of mandatory vaccinations, is it as simple as saying to enter the campus, to study on the campus, you have to be vaccinated against COVID-19?
Good afternoon, Stephen, and thank you for having me. Stephen, I'd rather use the word regulations. I think mandatory is too extreme a word all the time. But you're right, Stephen. At this moment, we as a country are facing a very difficult situation. Now, we're in a situation where the fourth wave is looming onto us. We actually know there are four key variables that lead us to the fourth wave. One being behavior, the other one is young people, the third one is vaccination, the fourth one is the invent of a new variant. And it's not just about the new variant or the new variant that we have discovered, but it's also the three variables. So young people getting vaccinated and having them with their behavior with us the only way our institutions can hold the academic year. We also have a same situation where parents are writing to the institutions of higher learning and saying that we're paying you fees, we're paying everything for our student to build a new skills economy or building a graduate around us. And now we are doing 30%, say, contact learning, and 70% all the skills training is done by remotely. And all these institutions were built for contact learning. So it's a very difficult time for our institutions at this moment to look at business continuity, academic year, the private sector, the government sector, the non-for-profit sector that is asking for these skills to be employed in the system. And that is where we are finding ourselves in the post-school education, mounting with so many answers to be given. And that is where the word regulation starts coming in very quickly, because we start seeing from the lens of business continuity or academic year perspective to say, okay, if we have to build skills, if we have to build this economic dividends from our economic sense of building this next generation of skills economy that resides in the post-school education, then we probably have to open contact learning. We have to provide, I can't imagine myself as a doctor or engineers or miners, plumbers, automobile industry coming out completely through online learning. There are skills that cannot be taught, and that has to be done through contact, which involves congregation, which involves people to come together. And then the question starts looming in vaccinated people mingling with non-vaccinated people. So the higher education is, yeah?
I'm sorry, Dr. Ahluwalia. I mean, the question, of course, becomes what happens if someone refuses to get vaccinated. I mean, that's where it gets sticky. It's fine when everyone agrees. It's fine when most people agree, and I think most people do. The question, of course, comes when people don't want to get vaccinated and absolutely refuse. Now, I don't think there are many people like that, but that's where it gets very difficult.
You're absolutely right, Stephen. According to our data from the ground, we've got 1/3 of our student population which is already either vaccinated or in the process of completing their vaccination, which means they've done their first dose and they're waiting for the second dose. We have a middle 1/3 population of student community that believes in vaccination but are taking time. They want questions to be answered. They want more interaction. They want time. And that is the space that we are now engaging towards the strategy called the middle 1/3. But we are also aware of the last 1/3 that has just been anti-vax or absolutely not completely made their mind of not having the vaccine. And it's a difficult question or difficult situation for the young people. So institutions of higher learning, where we established vaccine centers very early, now we're 2.5 months down the line, and we are really putting a very strong vaccine promotion project. We have vaccines right in the access to them. And still we're finding a deadlock of not having a complete vaccine hesitancy or people not absolutely putting into this. And those universities are now, and they know their business continuity cannot work without not having contact learning, are now in the process of finalizing something called mandatory vaccination, which we term as regulations. But there are other institutions which started the vaccination drives later due to their being in the rural sphere. Vaccine points establishment took time, and there are convincing arguments where students are still engaging with the probabilities of more question-seeking answers or mind-seeking probabilities of getting vaccination. And those are the institutions that are still in the consultative phases, still pushing a little bit of vaccination program. Then we have the vocational space or the TVET space or the community only establishing our vaccination points for easy access of vaccination. And they are still about a month behind to this question of when to run application system at the and that application system is still uneven and it's taking time where certain are going with a one step forward and certain are still following the path in that route.
Professor, Doctor, I really do appreciate the time. Thanks very much indeed, Dr. Ahluwalia, the CEO of Higher Health. Well, in a moment, the issue of mandatory vaccination